We're talking with Dr. Jeremy Frank.
You can injure your hips. You can injure your low back. We see a lot of elbow injuries. We see a lot of wrist injuries in golf. We do see a lot of gymnastics injuries, but cheerleading, because of all the flyers and stunts in cheerleading, when those girls land, you're depending on 8, 10, 12-year-old girls to catch a girl who's 15 feet in the air. And so we see a lot of injuries, a lot of broken bone, a lot of torn ligaments, a lot of torn ACLs. Probably the two biggest offenders we see in South Florida are football and, believe it or not, girls soccer. Because in girls soccer, girls' legs are just naturally not as strong as men's. That's unfortunately just an anatomic fact. And so when girls cut and pivot on a dime or get slide tackled or run into another girl, they have a tremendous number of knee injuries. So we see a lot of ACL tears in female soccer players. I think football is an evolving sport. We're seeing right now that the number and severity of concussions that are really diagnosed is starting to dramatically rise. We're seeing, unfortunately, players at the NFL level who have retired and having post-concussion symptoms or having suicidal ideations. Unfortunately, some have committed suicide and they've made national headlines. So, concussion management in football is a very big deal. The NFL is tackling it. The NIH is tackling it. There's a lot of research going into it. And the bottom line is we don't know what football is really going to look like in 10 years. Are they going to take out the brutality of football? What's it going to look like? What are helmets going to look like? There's a lot of factors at play right now. Could be worse. It could be rugby. Rugby's football with no pads. We don't see a lot of rugby in the United States, but if you look at like Australia, South Africa, and the European Union, where rugby's very big, there's a lot of rugby injuries. There's a lot of research going into rugby, concussion, stuff like that, but we just don't pay as much attention to it, just like we don't with cricket in the United States. I think a common sense rule is that if people have a mild injury, you want to do simple things like rest, ice, elevate, and compress. So we say RICE for that: rest, ice, compression, elevation. If after a couple of days things aren't getting better, you're not able to put weight, things are progressively getting worse, it's time to seek out your local sports medicine provider so that they can provide the appropriate care for you and get you back to being healthy, diagnose a problem that may need to be diagnosed, treat you appropriately, and get you back out on the field to play safely. We're fortunate here to have U18 Sports Medicine, which stands for under 18. In reality, we take care of pediatric, adolescent, and even young adult athletes up to 25 years of age. So anyone who has injured their knee, hip, ankle, elbow, shoulder, or has any sort of sports medicine injury, we're lucky to have a comprehensive sports medicine center where not only do we provide board-certified, fellowship-trained sports medicine surgeons, but we have comprehensive diagnostic care in the form of x-rays, low-dose CT scans, MRI centers. We have the ability to perform physical therapy either before or after or in the place of doing surgery. We have the ability to brace our patients appropriately with various braces around the knee, ankle, hip, shoulder, elbow. And we have a whole complement of individuals who can provide nutritional assessment, psychological assessment, sports psychology, diagnostic management. Everything you can think of in a sports medicine center, we offer in one unique setting. And we have two locations. One location's in Miramar at Memorial Hospital, Miramar, and the other location is in Coral Springs, right off the Sawgrass. And you could find out more information at www.u18sportsmedicine.com.